for the technical difficulties. Although the event's supposed to begin at 10:30, we're having some technical issues. So could you please hang tight for a couple more minutes? Thank you.
Okay, I think most people are here. So shall we start? All right, so first we're gonna do like a basic introduction because this is our first event and stuff. So I'm CJ, co-founder and CEO of STEMology. And this is our first event. We're gonna have a presentation from Dr. Praveen Arany, who is a professor at the University at Buffalo and a researcher there too.
Okay, so hey everyone, this is Sai Param, the co-founder of STEMology as well. Some of you may know me as you go to my school. After the professor's speech is given, we will be having a trivia in which we will ask 6 questions. 3 of these are easy questions, 2 of them are medium questions, and whomever answers each question first in the Google form will be awarded a prize. So prizes are that for each easy question, there'll be $5 given out. And then for each medium question, $10 will be given out. There's a time limit configured that will track who answered first, and this will determine which individuals get which awards. Any participant can only get 1 award maximum, which means that no individual can get more than one award, even if they answer 2 or more questions correct. They will have to give up whichever answer when getting the prize in the rare event that one individual answers multiple questions correctly first. After that, we will be asking 1 hard question, and one of you guys will have to turn on your mics and answer the question right away. And through this, the individual who answers it to the best abilities will be given $15.
Unfortunately, the guest speaker was not able to be here, but he did send a video of his presentation that he recorded, which was the presentation he was going to give today. So I'll play that. Unfortunately, the guest speaker was not able to be here, but he did send a video of his presentation. Here it is.
Light is a... Hello, I'm Praveen Arany. I'm an assistant professor in oral biology and biomedical engineering. Today, I'd like to talk to you about our research at University at Buffalo in my lab that is focused on the use of light for improving human health as a medical treatment. So I'd like to show you a couple of a movie clip and then talk a little bit more about what kind of research we do. So here's the, that's not right. Let me share my PowerPoint with you. There we go. All right, so the title of my talk is Light Treatment for Healing Tissues. And I guess the best inspiration for all of us is movies, right? We watch a lot of cinema and different kinds of movies. And you might have seen several of these movies, especially Star Trek, where they're using light to treat people and improve their wounds or any injuries that they get. So there are various examples in cinemas and in movies where light has been used effectively. And I'd like to show you a brief clip from this movie, Oblivion, where they have actually used this in a very striking manner. So let me show you that movie clip. There we go. All right, so let's watch this clip together where Tom Cruise is being treated for his injury with this treatment. So a lady is basically cleaning that wound with a spray, which is a disinfectant. And then she grabs this device and starts treating him. Okay, so here's this is basically a cinematic expression of some of the research that we do. And I'd like to share some of the research that we are actually doing in my lab that is addressing this kind of treatment. So if you're looking at my slideshow right now, okay. So hopefully you're now looking at my slides again. There we go. Okay. So as we examine different kinds of treatments that have developed in medicine, we are drawn to the history of medicine, where several treatments used to exist. Now, here's an example of how ancient physicians or practitioners or healers used to drill holes in people's heads to make them better. Their understanding of the treatment was that they are letting out evil spirits and making the patient better. And there are some scientific descriptions, as you see in the middle panel here, and some not very scientific, almost hilarious, funny kind of depictions with a lady balancing a book on her head and a guy wearing a metal cap. So there used to be a time when drilling holes in people's heads was considered treatment. But we still practice that procedure today in modern medicine. And it is done in a very specific medical context, such as when you get an injury, like a road traffic accident, a car accident, or trauma in a football sport event, or ice hockey, more likely. So when you get increased pressure, intracranial pressure inside your brain, we now drill holes to let out the liquid and allow it to heal much quicker. There are other examples in ancient medicine where letting blood out of people, taking out large parts of the brain to treat schizophrenia, or physically stretching people, as shown in this image on your right. All of them are meant to improve a medical condition. We practice all of these in modern medicine, but in very specific medical contexts, such as in terms of bloodletting, we are now doing transfusion and dialysis to improve various systemic conditions. We can ablate a specific part of your brain to relieve seizures or epileptic seizures. And if you've gone to the dentist for your, to see your clips and braces treatment, you can actually move teeth very effectively with applying mechanical forces. So the difference between what used to be practiced and what is now currently used in the clinic is a better understanding of how this treatment works, right? They are still the same similar procedures, but the difference is that we now understand in which biological context we can use these treatments. When you think about light as a treatment, light is a physical form of energy, and we all know that light is a form of electromagnetic radiation. So visible light is a small part of the electromagnetic spectrum, which is used for our ability to see vision. But it can also be used therapeutically, which is what we'll talk about in the rest of the talk. And along the same energy spectrum, there are microwaves and radio waves, which we also use in our daily lives, as well as for cancer treatment, we use high energy radiation, such as X-rays and ultraviolet rays. Light is a very unique form of energy because it scans the largest scales that we are aware of. We talk in light years when we talk about distance between stars and universes. And at the very smallest of scales, where we talk about subatomic particles, light or electromagnetic radiation is a basic form of one of the 4 forms of energy that can intermediate different interactions. Light in biological systems and human health can be used to visualize molecules, tissues, or cells, and it can also be effectively used to treat people. Light as a treatment should not be surprising because we know that sunlight has a very specific effect on vitamin D metabolism. It activates vitamin D, which is necessary for good bone and teeth as well as psychological health. We also know that light is perceived, light, a physical form of energy, can be perceived as vision because of a specific protein that is present in the back of your eye, rhodopsin, that can actually convert the physical form of energy into a biological signal that is perceived as vision. Light has an important role in our day-night circadian rhythm, our diurnal cycle, as well as our psychological health. We know that well-lit places is good for our psychological health, while dim, poorly lit places are not. And therefore, we can use these different forms of biological benefits of light in our daily health. There are also very specific forms of light treatment that are used in practice of medicine today. And one of the most famous ones I'd like to talk to you about is photodynamic therapy. And Buffalo actually has a very intimate role in the development of this treatment. This gentleman on your left, Neil Rydberg Pinson, was using these lens apparatus to treat patients with infections in the skin. And he received one of the very first medicine Nobel Prizes in medicine in 1903. The gentleman on your right is Dr. Tom Doherty, who was an oncologist in Roswell Park, Buffalo downtown. And he was the one who's credited with performing the very first human clinical study using photodynamic therapy as a cancer treatment. So Buffalo has a very important role in the promotion of light. Our lab is focused on another form of light treatment called photobiomodulation. And we use this treatment to cure various diseases, everything from ulcers in the mouth to wounds on your feet to concussion or brain injury. So there are various treatments, and the third talk in this session today by Dr. Sharas Reddy, a fellow in my lab, will talk about photobiomodulation as a treatment tool. I will like to finish my talk by talking about one of the hottest topics now in our daily lives, which is the COVID pandemic. And you might have heard about how we can use different forms of light to destroy the virus. And we hear about ultraviolet light, and there are various forms of ultraviolet light that can be used to either sterilize a room. In this case, they're sterilizing an aeroplane. They can also use it for different spaces that we can operate. Now, this is a treatment where you're directly destroying the virus. But the other form of treatment, which we are researching in our lab, very similar to what you saw with that first movie clip, has been used to improve our resilience to infection. So these are two news stories about this treatment where a non-ultraviolet, non-ionizing form of light is used to improve the host, the patient's response to infection, and not directly kill the virus. So it's a non-viral targeting technique. And I encourage you to have the links here in the bottom so you can see both of this. But I'd like to end my talk by showing you that second story where people have used it very effectively to treat the patient with this non-ionizing form of it. So let's look at this video. And then after this, after the video is played, we can address questions.
I'm going to have to lie. That was pretty fascinating stuff. The patient was skeptical at first. Now, though, is true belief. He says he's breathing better because of it. Christy Lee explains how it works. No, that's not that we've ever been so healthy for a while. But in mid-April, COVID-19 quickly reminded Dr. Fernera. My energy was just slowly taken out of me. He struggled to breathe until Dr. Scott Sigmund, an orthopedic surgeon at Lowell General Hospital, came to his bedside. So he was in the hospital for about 10 days. He'd been in the ICU. He was almost intubated. And then they brought him back to a monitored floor. And that's where we got to meet him. Dr. Sigmund told him about his idea using laser light therapy. Because it works so well on acute inflammation. That's really what COVID is. It's really inflammation gone crazy. And so that was the concept of why we laser therapy. Patrick signed on to be the first of 10 patients in Dr. Sigmund's clinical trial. After about 3-4 minutes, I started breathing a little bit better. He received 1 treatment a day for 4 days. His chest X-ray improved dramatically. The lab markers that we look for inflammation improved dramatically as well. Dr. Sigmund knows that his clinical trial was too small. That's why he hopes a large research hospital will take what he started with a laser and conduct a bigger study to test his theory. He won me over. Patrick feels lucky to be alive. After 4 months of recovery and physical therapy, he still trembles with stamina and strength. But I'm on my way. It's a lot better. I've got my fighting chance. Christy Lee, NBC 10 Boston.
Okay. So hopefully you can see that we can use light in various unique ways to do different treatments. And having seen this PowerPoint presentation and the video clips, we will move to the live session in Zoom where hopefully we can address some of your questions.
He told me to, if any of you have questions, just type them in the chat. I'll ask them to him and get back to you about them.
So now that the professor's speech is done, I'm pretty sure Suche will post the link to the Google form or the trivia in a few moments, in which you will answer, and whoever answers each question correct first will be awarded prizes.
Right. So only 1 prize will be given to each person, no more than 1 prize for each person. So first to answer, I'll put it in the chat immediately, and first to answer, that's it. So let me just put it in the chat. Ready, set, go. And these are the medium and easy questions. After everybody answers these, I'll orally tell you the hard question, and the first oral response that is accurate gets them.
In terms of answering the hard question, what I would like to do is what we'd recommend is under like the bottom panel of the screen, there's a reactions button. You click that and raise your hand. Whoever raises their hand first will be asked.
The form saying you need permission.
For accessing?
Yeah, for accessing it.
Even this one? Either. Okay. Wait, what permission does it say you need exactly?
It just says you need permission. This form can only be viewed by users in the owner's organization.
Give me a minute.
Give us 1 minute, please. Sorry for the technical difficulties.
Okay. It should be fixed now, and I'm setting up the link. Okay, ready, set, and it's going to everybody. And this is gonna work. There. Yes? Any questions? Sorry.
The other side, you have your hand up.
Okay.
Oh, I don't have my hand up. I think that's the. I don't know if
Yeah,
there's a third side.
Oh, there's another. Okay. Satvik, you have the hand. You have your hand up too. Okay.
I think we have everybody. So the next question is going to be a hard question, and it's going to be asked and answered orally. First to raise their hand and speak out. That's it. So everybody put their hand down. Has it up.
I just have a quick question.
Sure.
So we raise our hand, right? Do we talk immediately or do you guys call on us and then we talk?
We
We
can
call on you, and then you'll talk.
All right, cool.
All right, so does anybody still have their hands up?
Suchi, I guess someone's hand is raised.
Yeah, I lowered it, don't worry. So the hard question is, what is the protein that allows light to be seen as vision? Yes? Satvik?
Satvik?
Is it rhodopsin?
Yeah, it is.
No.
All right,
Nice.
cool.
All right, so there it is.
So there we have it.
The winner of the
Yes,
hard
that-
question is Satvik. But yeah, do any of you have questions you'd like me to ask the guest speaker that I can get the answers back for you? No?
So thank you very much. And we will, in terms of the multiple choice part for the easy and medium questions, we will get back with you for successful participants who answered each question first. And we will send you
Wait,
to your email that you applied.
People are still asking, so let's not end the meeting yet. So
Yeah.
Okay, just type it in the chat if you need to, the questions. All right, I'll just share Google Slides, and you can put all the questions there. Just go on there, make a new slide if needed, and then just put all the your questions on a unique slide, along with your name. So. Okay, so here's the link. It's in the chat. Everybody can type their questions right there.
Does anyone in this meet so far have any questions about us in terms of STEMology and its organization? Feel free to ask.
By the way, if anyone wants to join, the application link is on our website, which I can put on in the chat.
So like what are some of the stuff you guys do? Like what kind of club are you guys?
So we're a nonprofit organization. Our main goal is to engage all students across the world to participate in STEM-related activities so they can adapt to the ever-growing technology and the modern-day careers that are offered. And so what we do is we just host seminars like this one, where we have calling guest speakers that are qualified with a university degree or bachelors, in which they speak about STEM significance, so we can help inform like people all across the world about that. And also, we're planning on having seminars where we'll do workshops. And I guess what you can add on.
Yeah, that's we're still working on it, but we're hoping to go to some underprivileged places also and help out there and spread STEM to students there who don't really have access to it yet.
Uh, I have sent the donation link. If you guys can be kind and help us to encourage the people, other people in learning STEM, it would be good. So I've sent a donation link in the chat. So please do donate with your kind heart.
Got it.
I Are there any questions? I don't see any on the slides. No questions? Okay then.
So in terms of this event, do you have any feedback for us for our next upcoming event, for any improvements, just so we can, make things better for next time, or?
Thank you.
Thanks.
But yeah, if anyone has any questions, you still have the Google Slides link. Just post them on there. And we'll see you at